We know that COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illness and recover without ever needing to go to a hospital. A new paper published in the academic journal Brain, published by the Oxford University Press, now looks closely at the neurological manifestations and COVID. Some of the cases look at patients who have been mildly affected or recovering COVID-19 patients with serious brain conditions. It's only a small percentage of people, but doctors are asking for more research on the impact of COVID on the nervous system and particularly the brain. Well, to talk to us about the research paper, we are joined from London by Dr. Jemeen Sreedharan. He's the Van Geest Postdoctoral Fellow, Honorary Consultant Neurologist, Department of Basic and Clinical Neuroscience at the King's College London. Dr. Sreedharan, thanks so much for joining us and speaking to us.
Thank you.
Now, you are one of the key scientists and experts who's worked and contributed to this paper. What are the main findings, and is there a link with an increase in neurological conditions linked with COVID-19?
Yeah, I mean, it's a condition that's affecting the COVID. It's obviously affected the entire planet, and I think a lot of the neurological complications that we're seeing are not unexpected. But what's happened is because so many people have been affected by the virus, it's become increasingly clear that there is a neurological burden. So the condition is, it's a mixture of different neurological complications. So the brain is normally an immune privileged site. It's something that's protected by the skull and by membranes. And it's normally not affected by peripheral conditions like the infections. So it's the manifestations could be a direct consequence of the virus affecting the brain. It could be what we call parainfectious, which means that the immune system seems to go awry and starts attacking the brain as well as attacking the virus. And it's also partly a complication of the serious medical effects that the virus has on the other parts of the body, like the heart and the kidneys, and obviously the lungs. So all of that creates a lot of stress on the body, and the brain is a very sensitive organ, and it suffers as a consequence. So a lot of patients don't have any symptoms at all. So the vast majority of patients will not have any symptoms. Of those that do have symptoms, only a small minority will end up needing to have hospital care, and only a small number of those will actually have neurological complications. So it's not something that is going to affect a lot of people. But the thing is that when it does affect you, it causes severe complications. What the long-term burden is going to be is unclear.
And what's worrying, perhaps, doctor, is the fact that it says that even people with mild symptoms, so it's not like, you need to have many severe symptoms, but even people with mild symptoms could end up with neurological problems. I mean, that's something that's perhaps emerging from this study.
Yeah, I mean, we have patients who have no respiratory symptoms, and they turn out to have symptoms that sound very much like schizophrenia. They have psychotic episodes without having any respiratory complaints, and they turn out to have they're positive for the virus. So that shows how the virus can affect the brain without actually directly affecting the peripheral organs. So that shows how it can have an effect, perhaps via the immune system. It's not uncommon. There are other kinds of viral encephalitis that are caused by immune attack in parts of the brain that can cause psychotic episodes. And this seems to be another virus that can do that.
Another paper, which was published in the Lancet, Neurological Associations of COVID-19 on the 2nd of July, says that although predominant clinical presentation is that respiratory disease neurological manifestations are being recognized increasingly, the proportion of infections leading to neurological disease will probably remain small. I think that's something that you've also said, that the percentage is going to be small. But that study, in fact, goes ahead and says that, however, these patients may be left with severe neurological problems, and that once infected, the overall number of such patients and the associated health burden and social economic costs might be large. Healthcare planners and policymakers must prepare for this eventuality, while the many ongoing studies investigating neurological associations increase our knowledge base. How worried should we be?
Well, I mean, we should be Very worried, because this is unprecedented in our times, right? To have a virus that's affected everybody on the planet is something and every country on the planet means that we should be very worried. And you're absolutely right. Okay, it's rare to get these neurological complications. There'll be a lot of patients who will have fatigue and kind of brain fog, as people call it, where they're not able to focus and concentrate. Is that a consequence of the virus? We don't know. We have patients who have apparent miraculous recoveries, but they don't make complete recoveries. And we don't know when patients do recover, whether they're going to recover completely. We don't know whether some of the neurological manifestations are going to result in long-term pathology, long-term morbidity. So a lot of patients will have long-term morbidity. The strokes that we're seeing with patients with COVID-related neurological complications are severe, more severe than you would ordinarily see. The kind of renal complications and the respiratory complications, as everybody knows, are going to cause long-term problems. The CT scans in the chest are quite striking, right? And people, although they may recover and go back to work, they're never quite the same necessarily. And I think the same will apply to the brain. And the thing with the brain is that you can't regenerate nerve tissue. You can't recover to the same extent, anywhere near the same extent, if you were to sustain an injury to the brain. It doesn't have that capacity. That's one of the unique things about the nervous system, in that nerve cells, once they die, they do not come back.
And that's very worrying indeed. Around 40 patients is what the study looked at. It obviously talks about the fact that more patients need to be examined. One of the patients, I think, that the study looked at was a 55-year-old woman with no history of psychiatric illness, and how she was behaving apparently oddly, that after being discharged, she apparently saw monkeys and lions in her house. So obviously a sense of delusion there, and this is after she was discharged. Other symptoms as well, other neurological disorders as well. Talk to us about some of those.
Yeah, so that would be her hallucination rather than a delusion. So she's actually seeing these things, and that all sounds like these are features of psychosis. And psychotic episodes as a consequence of viral infections have been seen before, but it's quite striking the observations we're making with COVID-19 related neurological complications. So those symptoms are hopefully going to be transient. These patients are seen by different individuals. So one of my patients was included in this study, and everybody who has a patient included in this study will be kind of very carefully following up these individuals and hoping that they will improve. At the moment, the care that these individuals require, these patients, is supportive to make sure that they recover from the effects of the virus. And any further neurological complications have to be treated as well. So stroke individuals have to be given appropriate anticoagulation. Patients with psychosis like this will have to be treated potentially with antipsychotic medication. And the hope is that these conditions will settle. The long-term burden, the consequences of this, we still have to wait and see.
And also another issue that's coming up, several scientists have written to the WHO talking about the fact that this virus is also airborne. It can be in the air for quite some time. That's, of course, something that the scientists have asked for more research. The WHO, of course, has been saying from day one that wear a mask. Finally, President Trump has also been wearing a mask. So how seriously should we take this fact that, it could be airborne as well? And that, of course, changes dynamics altogether. How worried are you?
Well, look, this is the reason I look like this, because I've not been out. I haven't got a haircut in 6 months, and I think there are people out and about in London who are behaving like this has gone away. It's not gone away. We completely underestimate how bad the situation is. A lot of people are behaving very sensibly. Okay, which is important. But it's important that as many people as possible adhere to the rules, okay? And the rules are there for a reason. And part of the reason for being cautious is because we simply don't know how bad the virus is, and how, in terms of the ability for it to spread from individual to individual. But as the evidence is coming out, it's increasingly clear that it's airborne, and masks can make a difference. And if everybody wears a mask, it significantly reduces the risk of the virus being spread. And it only takes a few individuals to spread the virus for it to just go completely out of control. where people are complaining about there being a lockdown, and I appreciate that. And that's, it's having a massive impact on the economy. But imagine if we have a second lockdown over the Christmas period and over the New Year period, right? I mean, the consequences of that would be even worse than what we're having now. And it goes on and on and on. So I think everybody has to make a concerted effort, government and individuals. It's up to both government and individuals to make concerted effort to kind of stop this from happening.
And obviously, the study that you worked on, that work continues. But I think it's also what I think the scientists are saying, that that we have to look at it as more than just a respiratory infection. That as far as COVID-19 is concerned, what are some of the problems or some of the issues that patients you have observed in, as far as the neurology of that is concerned? What are some of the issues and problems that they have faced?
So I've seen not just the one of the patients that was included in the study, but other patients who've had, young patients. I've seen a physician who had pain and weakness in feet and hands after treating patients with coronavirus. So she developed symptoms, became sick, went off work, then came back to work, but then wasn't quite right. And she's had to go off work again. So that's a major sequelae of having the coronavirus infection. A physician who has made personal sacrifices in order to kind of help patients has herself become a victim of this and herself developed neurological complications. So her imaging of the brain and the spinal cord were normal, but this suggests that she has a peripheral neuropathy, which is a completely different kind of manifestation of a neurological manifestation of the virus to the patient that was included in the study. But there are a number of other patients who are included in the study that have, by other colleagues of mine, who have had peripheral neuropathic problems like this. But that's a personal kind of story that I can give you of a physician who's had neurological problems. And we've had plenty of other physicians who've died, physicians, nurses, hospital workers who have died as a consequence of this. And it wouldn't surprise me if some of those had neurological complications, because a lot of them would have been on intensive care. And intensive care in itself is a big stressor and can cause problems with the nervous system.
Okay, and as far as your field of specialization and of course this particular study is concerned, do you feel that enough is being done as far as research is concerned? Because this is something that seems to have now emerged, both from your research as well as the one in Lancet as well. Both seem to be pointing at neurological problems associated with COVID. Do you feel that there is enough that's being done, or do you feel that more needs to be done, more research needs to be done, and what are some of the areas that you'd like to see perhaps more work done in?
Well, more research always needs to be done, and particularly in this area. The nervous system is incredibly difficult to study. Patients with neurological problems are incredibly difficult to study. They have incredible morbidity, they have incredible kind of disability. If they have an infection on board, it's very difficult to actually get close to them. It's very difficult to do the kind of tests that we need to do. If you have to do an MRI scan, it requires them to be moved with, MRI compatible equipment from intensive care into a machine. The room and everything has to be cleaned, after the patient has gone in there. These tests are very expensive. And the studies, the pathological studies that have to be done afterwards are only just emerging. So acquiring the appropriate specimens from patients is invasive during life. For example, lumbar puncture, that again requires, it's a relatively invasive procedure, but it's important. And then trying to get tissue to do studies is also difficult. It's not simply a matter of biopsying the brain. Post-mortem studies are important as well. So sadly, as you know, a lot of patients die, and the neurological problems may increase the chances of you dying as well. But we are able to get brain tissues on these individuals. Those studies are only just emerging. And given how long this disease has been going on for, I think it's something that we need to focus more on.
And lastly, Dr. Sreedharan, anything? What's your advice to people out there? What should they be doing? What can they do to protect themselves better? The fact that more manifestations are coming out, we're just finding out more and more about this. The fact that perhaps there could be a larger risk being airborne. What can the average person do?
Everybody knows exactly what they need to do. They've been told right from day one what needs to be done. Right, the WHO got it right. People should stay at home when they can, okay? They should stay away from other people, even their relatives. If they're not living in the same house, they should stay away from their relatives and friends. They should maintain a distance, right? This is not the time to party. This is a time to basically continue to follow those rules. And it's important, look, everybody talks about the economy and about jobs and about maintaining a normal way of life. And I'm not sure we're there yet. So that requires government support.
Absolutely. I think that's crucial as well. We can definitely do our bit, and it's just easy. Just maintain safe distance, wash hands, wear the mask. I think now the fact that several politicians are also, I think, coming around to that reality, I think that's helping as well. Dr. Jemeen Sreedharan, thank you so much for joining us on this. And thank you again as a frontline fighter and of course warrior along with the entire team. Thank you so much for sharing your expertise on this very, very important subject. Thank you.